Homeosomatic lymphedema therapy, as taught at the Blue Heron Academy of Healing Arts and Sciences. Hello, and welcome to this presentation on homeosomatic lymphedema therapy, as it is taught and practiced at the American Medical Massage Association National Training Center, the Blue Heron Academy of Healing Arts and Sciences. Dr. Lawton founded the Blue Heron Academy in 1980. And since that year, over 14,000 students have studied and trained in the advanced systems of medical massage therapy, medical manual therapy, and Scandinavian mobilization therapy. Dr. Lawton is a licensed chiropractor, napropath, and acupuncturist, as well as a certified naturopath, with over 50 years of experience in manual therapy practice and education. The AMMA and the Academy offer some of the most advanced programs and training available in manual therapy and manual medicine. The Homeosomatic Lymphedema Treatment Protocol is the most advanced and comprehensive edema treatment protocol available anywhere. My name is Chrissy Dawn, and hopefully I will be your guide to a better understanding of homeosomatic lymphedema therapy. Let's begin. Homeosomatic lymphedema therapy. This brief presentation covers a series of treatment protocols for the management of disorders associated with the movement of fluid from interstitial tissue spaces and the movement of fluid through the lymphatic system, as well as the treatment of edema and secondary disorders, conditions, and diseases. This subject of lymph and interstitial fluid hydraulic and osmotics requires a brief review of the filtration and osmotic mechanisms that control cellular, interstitial, vascular, and lymphatic fluid balance. Also required is a review of some of the pathological conditions that affect the fluid regulation systems of the body. In the 1970s, I studied the Vader method of lymph drainage at the Chicago National College of Naturopathy. Since that time, and during over 25 years of clinical practice and experience in treating edema, I have refined and I feel improved upon the techniques of manual lymph drainage. I feel that as you, the student or practitioner of medical massage, review the mechanics and physiology of these clinical techniques for manual treatment of edema, you will find a systematic and detailed approach to edema therapy. I do not often hear it talked about, but regarding manual therapy applied for the purpose of lymphatic drainage, an important point should be mentioned. In manual lymphatic technique, the therapist is attempting to restore normal fluid movement through the lymphatic system, vascular system, and interstitial spaces. Normal fluid movement or activity would be a homeostatic mechanism. Lymph fluid moves through lymph nodes at a specified rate or gradient. As the lymph moves through the node, it is filtered and acted upon by components of our immune system. The normal homeostatic gradient allows immune and filtering tissues the time they need to act upon antigens and foreign materials in the lymph fluid. The role of the therapist is not to bypass or accelerate this natural mechanism beyond its capacity, but rather to encourage homeostasis. The approach that we take to this therapy is called the homeosomatic system. Homeosomatic simply means that the body responds best to modes of treatment that are most like the body's natural systems and functions. This presentation on the manual treatment of lymphedema is not meant to be exhaustive. It is not a pathological or histological review of the subject. It is not an attempt to outline a detailed medical approach to lymphedema treatment. Lymphedema manifests in several different stages, representing varying degrees of severity. Its most extreme manifestations are best treated in clinical facilities designed to manage these cases. The average massage therapist and massage therapy clinic is not designed to provide safe and effective care to patients suffering from the more severe stages of lymphedema. They cannot handle the potential complications, such as infection, that might occur. Poor or incompetent management of the lymphedema patient may result in further trauma to the lymphatic system, with a worsening of the patient's condition or infection. There are, however, many patients that are seen in the massage therapist's office who present with so-called subclinical symptoms of lymphedema. These patients often present with acute swelling, chronic but stable edema, and are in an early stage of the disease process. These are clinical manifestations of lymphedema that can be effectively treated by the massage therapist who is trained in effective manual therapy, dietary, and exercise approaches to lymphedema treatment. The material in this volume is foremost a manual therapy program that outlines a comprehensive manual therapy protocol for the non-invasive treatment of lymphedema by the massage or manual therapist. Early identification and treatment of lymphedema can help to prevent the progression of the disorder or to cure the problem before it becomes a more severe condition. Later stage lymphedema is largely not curable, but manageable. Treatment is mostly palliative and provides temporary reduction of swelling and relief. Lymphedema, even cases secondary to surgery or radiation, most often has a very strong lifestyle and behavioral component and is commonly associated with heart disease, lung disease, obesity, diabetes, and alcoholism. Probably the most significant problem with incompetent massage or manual therapy care of lymphedema is simply ineffective treatment. Certainly, deep tissue therapy is inappropriate and could cause further damage to lymphatic vessels. The most common problem seen with massage and manual therapy is a failure to move protein from the interstitial spaces into the lymph vessels. If only water is moved and the protein remains, then the edema will return very quickly. Long-lasting results occur when the massage or manual therapist can move both fluid and protein out of the interstitial spaces and into the lymphatic system. Patients who present with signs and symptoms of lymphedema should always be evaluated by a medical physician to determine the cause of the edema, appropriateness of manual care, and possibility of combined medical care. Homeostasis of the lymphatic system. The lymphatic system is part of the fluid matrix of the human body. The water of the lymphatic system, lymphatic fluid, is part of the 75% of the fluid composition of the body. The lymphatic system serves as a channel for the parts of this fluid that moves through lymphatic vessels. The body carries out the metabolic activities of life through form and function, and the lymphatic vessels provide both. Lymph fluid is produced from plasma and is filtered through blood capillary walls. This filtration process is regulated by a protein osmotic gradient. Different parts or organs of the body, such as the liver, for example, have different filtration rates. The liver is so permeable that the filtration process is continual. The extremities, arms and legs, depend upon muscular activity to move lymph fluid through the lymph vessels. With metabolic, organic, or mechanical disorganization of the lymphatic system, the limbs may experience an accumulation of fluid and develop edema. The larger vessels that comprise the lymphatic system have valves that direct the lymph toward the lymphatic ducts and into the bloodstream. The purpose of the valves is to prevent a backflow of lymphatic fluid. Muscular activity, peristalsis, respiration, and body movement all create pressure on the lymph vessels that moves lymph fluid towards the heart and back through the circulatory system. Throughout this system, there are lymph nodes or glands that act as filters which hold back and process small particulate matter. This matter will include bacteria and other invaders, cell debris, metabolic byproducts, and protein. This filtration process comprises the second area in which time is a factor in lymph fluid movement. The first area was the osmotic gradient, and the second area is the node filtration gradient. Lymphedema results from interference with the normal flow of lymph from and through an extremity. When lymphedema results from a congenital cause or developmental abnormalities due to hypoplastic or hyperplastic involvement of the distal and proximal lymphatics, it is a primary form. Primary lymphedema may be due to obstruction in the pelvic or lumbar lymph vessels and/or nodes. When this condition occurs, the disease is extensive and progressive. A secondary form of lymphedema occurs from infection, inflammation, and/or mechanical obstruction of the lymph nodes and/or vessels. Back pressure within the lymphatic vessels produces a destructive dilation that injures the lymph valves. The lymph valves become incompetent. Normal fluid movement is disrupted, and the lymph fluid protein levels increase, resulting in fibrosis. The affected area or limb will demonstrate painless swelling and edema. This continues into pitting edema, followed by brawny, non-pitting edema as the condition progresses, ending in episodes of lymphangitis and cellulitis. Chronic general edema not related to an acute trauma should be evaluated by the patient's medical physician. Preventative care and management of lymphedema. Lymphedema commonly occurs secondary to obesity, diabetes, alcoholism, heart disease, kidney disease, liver disease, cancer, and medical intervention and treatment. It also is caused by the treatment of the above conditions, including surgery, chemotherapy, and radiation. Dietary programs and rational nutritional approaches to the treatment of these disorders is the major method by which lymphedema can be prevented and controlled. Dietary and nutritional programs include natural whole foods in the diet and complex carbohydrates in the form of fresh fruits and vegetables, whole grains, and legumes. Furthermore, low to moderate amounts of refined processed foods, especially simple sugars and carbohydrates, refined fats and oils, and meat, should also be considered. It is also important to eliminate the intake of cola and soft drinks, caffeine, including beverages and chocolate, and all alcoholic beverages. Dietary and nutritional approaches to lymphedema therapy also includes therapeutic dietary and herbal programs designed to treat the initiating condition or conditions that precipitated the lymphedema. Unlike synthetic drug therapy that often causes catastrophic side effects and has no nutritional value, dietary and herbal therapy supply the tissue and organs with valuable phytochemicals that have both drug and nutritional effects on cells. Of value in treating lymphedema are phytochemicals that support tissue strength and integrity and that are antibiotic. Topically, this would include castor oil, golden seal, and comfrey. Internally, poke root, persica and rhubarb, stone root, barley green, and bioflavonoids would be helpful. Therapeutic exercise and recreational activity. Exercise is a vitally important component in the prevention of or management of progressive lymphedema. Its importance cannot be understated. It is probably the single most important act of self-care that a patient can perform. The worst thing that a patient with lymphedema can do is remain sedentary and inactive. Exercises should be mild to moderate in activity levels. All exercises should have the characteristic of low impact and gentle repetitive motion. Gentle repetitive movements of low intensity over a longer period, perhaps for 45 minutes, are beneficial and safer than higher impact, strenuous, more intense activities. Skin care. The skin in moderate to severe lymphedema is often compromised and easily subject to injury and infection. Stage 2 and Stage 3, lymphatic elephantiasis, commonly presents with ulceration, hardening of the skin and dermal tissue, and papillomas of the skin. The skin should be kept clean, and frequent bathing in tepid to warm water is recommended. Hot tubs, whirlpools, and higher temperature water and heat should not be used on the involved area or limb. Antibacterial herbal soaps are recommended for cleansing of the skin. In subclinical stages or stage 1, mild dry brushing, with avoidance of skin injury or abrasion, is recommended. While the use of heat and hot packs is generally discouraged when ulceration, inflammation, or papillomas are present, castor oil packs, Edgar Cayce method, are very effective in treating subclinical or early stages of the disorder, especially when hardening of the skin is involved. Castor oil stimulates lymphatic activity, including phagocytosis, fluid shifting, and it assists in normalizing collagen fiber remodeling. Thereby, it reduces the formation of scar tissue and adhesions. When castor oil therapy is combined with mild heat and rubbing, it penetrates the skin and creates localized beneficial effects in the tissue. If the abdominal area is not directly involved in the disorder, abdominal castor oil packs are recommended. Common sense must be used not to apply extreme, prolonged heat to areas of inflammation. Medical massage and manual therapy. The earliest known references to massage and manual therapy date back 11,000 years to the Egyptians. It is difficult to attribute the discovery of manual lymphatic drainage technique to any single individual, and historical evidence demonstrates that manual lymphatic drainage techniques, very similar to techniques used today, were routinely used by manual therapists in the mid to late 1800s. One example being Alexander von Winivarter, a German surgeon. Perhaps best known for their work with lymphedema are Emil and Estrid Vader. In the 1970s, Michael and Ethel Foldy developed complete decongestive therapy by adding bandaging, exercise, and specific skin care to the Vader's technique of manual lymphatic drainage. In terms of the hierarchy of care, after exercise and dietary control of the primary disease, manual lymphatic drainage is one of the most valuable therapeutic tools that we have for the treatment of lymphedema. Some authors and developers of manual lymphatic technique attempt to claim exclusivity to specific massage or manual techniques based on the claim that only a technique delivered in a specific manner will be effective. While promoters of specific trademarked systems of therapy may attempt to lay claim to the ascendancy of their own systems of therapy, research regarding standard massage techniques, such as compression and effleurage, do show lymphatic fluid movement and fluid shifting in the tissues. Tissue compression creates a muscle pump, which causes fluid shifting in muscles and connective tissue while the technique is being employed. Mobilization techniques applied to the joints of the extremities demonstrate increased lymphatic fluid movement around joints and synovial pump activity inside the joint. Therapists who only consider the effectiveness of a technique relative to the movement of lymph are overlooking the more global effect of fluid shifting and the combined movement of all fluids in the tissue environment. It is true that there are specific parameters that need to be observed during a massage or manual therapy treatment, but there are a variety of hand and mobilization techniques that are effective in the movement of lymph fluid. The specific parameters that should be followed include: 1. Elevation of the treated limb or area to be treated. 2. Slow, gradual, sustained pressure from distal to proximal. 3. Firm but gentle pressure to the tissue. 4. Avoidance of hard pressure or deep tissue techniques. 5. A multimodal approach employing massage and mobilization. As has been mentioned elsewhere in this presentation, the therapist practicing manual lymphatic drainage technique must work with the body's normal homeostatic mechanisms, even though those mechanisms may be severely compromised by disease or medical intervention. The therapy must gradually induce the fluid and protein accumulations in the tissue to move out of the interstitial spaces and into the lymph vessels. If the protein that accumulates in these spaces is not moved, then only water is moved, and the body's natural process of diffusion will cause a rapid return to the pre-treatment edematous state. This suggests that the massage and manual therapy technique must be slow and gradual. It must be delivered to both the level of comfortable tolerance of the patient and with a light enough pressure that allows protein and fluid shifting and does not further compromise or injure the lymphatic vessels. Clinical opinions differ regarding how much pressure is too much pressure. However, the skilled and experienced massage or manual therapist will know, based on training and patient feedback, what degree of pressure is effective and beneficial. Generally, pressure is applied to an area at no more than 1 or 2 pounds, but this determination is largely a factor of the degree of tissue morbidity and sensitivity in the area being treated. For patients who present with a high degree of sensitivity to massage and manual therapy, light to mild compression of the tissue is not the only tool that the therapist can employ. Elevation combined with passive repetitive movement and motion of a joint is another highly effective treatment modality. With this technique, no pressure must be applied to the surface of the involved area. In addition, the Castle method of gentle extremity rocking can also be employed as a lymphedema treatment modality. Another highly effective mode of therapy that is beyond the scope of this manual is hydrotherapy. Hydrotherapy is underutilized for this condition and yet is probably the single most effective treatment technique available for the treatment of lymphedema. Fluid movement in the human body is governed by many interacting and complex factors. Some of these factors are chemical, and others obey the laws of physical mechanics. Fluid commonly accumulates around joints, causing soft tissue swelling, discomfort or pain, and interference with the normal function of the affected joint. When fluid accumulates in the interstitial spaces in between joints, the large areas of soft tissue mass, basic lymphedema techniques involving elevation, progressive soft tissue compression, and contraction and relaxation of the muscle tissue will readily stimulate movement of fluid through the lymphatic vessels. However, the joint complex, because of its bony architecture, is resistant to compression technique. Therefore, other forces of physics must be employed. To effectively stimulate the movement of fluid out of the joint complex region, repetitive movement technique is utilized. Repetitive movement technique simply involves the repetitive movement of a joint in accordance with its primary plane of motion. This movement of the joint encourages accumulated fluid in and around the joint to move out of the joint capsule and the interstitial spaces and into the venous or lymphatic systems. Fluid reduction results in the following. 1. Less hydraulic pressure on the soft tissue structures. 2. Reduction in pain or discomfort. 3. Improvement in joint range of motion. 4. Reduction in inflammation. 5. Improvement in the normal circulatory processes of the joint complex. 6. Reducing the stress on the joint complex. These benefits of repetitive movement technique are important objectives in the goal of patient rehabilitation. It is only through the step-by-step application of this medical massage treatment protocol that a serious impact can be made on significant lymphedema. Elevation. Water generally flows to the lowest point. The purpose of using elevation in lymphedema technique is to use this principle of physics to aid in movement or flow of body fluids from the most distal points to the centrally located lymphatic collection centers. It is important to understand that in this procedure, there are many physiological processes involved, some mechanical and some metabolic. In lymphedema therapy, we are attempting to encourage the flow of lymph fluid through the lymph vessels. We are also attempting to stimulate a reduction in interstitial fluid accumulation. The movement of fluid in the lymph vessels is hydraulic, but the interstitial fluid exchange system is metabolic. Mechanical and hydraulic systems can be relatively easily affected by manual techniques. Metabolic processes only occur at a predetermined rate. Mechanical techniques can encourage and stimulate homeostasis, but will not overstimulate natural systems. Synthetic drugs, such as diuretics, can and do overstimulate the body's fluid balance systems, resulting in eventual cell and tissue damage and failure. Progressive capillary propulsion. Most systems of manual lymph drainage contain compression techniques that encourage the movement of fluid from the distal portion of an extremity toward the lymph collection centers at the heart. This system uses the same principle. Progressive capillary propulsion describes the process of capillary action. Once we begin to apply a progressive, compressive, squeezing manual technique from the distal endpoint of the extremity toward the lymph collection centers, the molecular movement of the fluid tends to draw additional fluid along in a process called capillary action. Muscular contraction and relaxation. The primary method by which lymph fluid moves through the lymph system is through muscular contraction, which propels the fluid through the lymph vessel. Within the lymph vessels are one-way valves that, when intact, prevent a backflow of lymph fluid. By using a patient-assisted active muscular contraction and then muscle relaxation in between the manually applied progressive capillary propulsion technique, we utilize the muscular system to assist in the movement of lymph. This combination procedure is more effective than simple elevation and squeezing alone. Manual technique, the wringing and squeezing method. Various hand techniques may be employed for the purpose of encouraging lymph flow through the lymphatic system. Some hand techniques involve using the edge or palm of a single hand and applying an intermittent compression or pumping action. The technique of wringing, that is, entirely surrounding the extremity with the hands as much as the circumference of the extremity or area will allow, and applying a squeezing compression of the soft tissue, is recommended. This technique is a two-handed technique. The wringing and squeezing compression is applied from distal to proximal and usually requires several repeated applications. To maximize the flow of lymphatic fluid toward the lymph collection sites, this should be done 3 to 4 times. Homeosomatic lymphedema general treatment protocol. In the homeosomatic lymphedema treatment protocol, we are combining several progressive steps or stages of treatment with one important additional factor: time. Some procedures and the body's response to them take time. We evaluate our success in treatment of lymphedema upon the clinical result or response that follows each step in our protocol. After we have applied repetitive movement technique, lymphedema technique, including elevation, progressive capillary propulsion, muscular contraction and relaxation, and extremity wrapping technique, we can begin compressive stroking from distal to proximal towards the lymph collection sites. Additional techniques, procedures, and components of the homeosomatic lymphedema therapy protocol include extremity rocking, the Castle technique, engagement of the thoracic pump, extremity wrapping and compression, rib and thoracic technique protocol, abdominal and pelvic massage, therapeutic breathing and diaphragmatic exercises, ancillary techniques including ice massage, hydrotherapy, pool aquatics, alternating hot and cold water spray, whirlpool bath, herbal topical preparations or compresses, castor oil pack application. For a better understanding of this highly technical and step-by-step treatment protocol, we invite you to enroll in the Advanced Medical Manual Therapy Treatment Program classes conducted at the Blue Heron Academy, or to attend our in-person seminars on this protocol hosted at the Academy by American Health Source. This has been your narrator, Chrissy Dawn, and it has been my privilege to hopefully guide you towards a better and deeper understanding of homeosomatic lymphedema therapy. Thank you for your kind attention during this important presentation.